depression can strike anyone. Depression is really a loss of emotional energy when you look at it in whole. And I believe that it really stems mainly in our society from anxiety, from that worry, from that what if, emotionally exhausting yourself to the point of depression. Some of us are more prone to depression than others. Some of us battle a little bit further back and forth in our emotional spectrum. Some of us stay a little bit further down on the end of just not feeling good, not finding pleasure in life. Depression usually manifests itself in a fairly classic mnemonic you're taught in medical school. And what you're looking for is difficulty with sleep, energy levels being down, guilt feelings that are overwhelming, appetite loss, nervous energy, whether it's manifest as lethargy, that you do not get out of bed or you just cannot sit still. Obviously, the feeling of being depressed is another thing that you ask about. I rely an awful lot on intuition, and I can feel it when I walk in a room, and I will barrel through what the other reasons for their visit is. A lot of people won't come in for depression, but in general, as you engage in a dialogue with them, you can see that they are just emotionally exhausted. And that's the majority of the type of depression I see. I believe that is a cultural phenomenon, mainly in our society, because of the emotional exhaustion that all of those other anxiety and choices create for us. There is a big stigma associated with depression, and I find that our culture is slowly but surely coming around to the fact that this can exist. I think that it comes around to that point because it's become much more mainstream. That was mainly, I believe, by the introduction of medications that were fairly effective at handling anxiety. 30 years ago, medications that you were treating depression and anxiety issues had so many side effects, so many drug interactions that physicians like myself didn't deal with it. We sent them on to psychiatrists. Well, what's happened with the invention that Eli Lilly came out with fluoxetine or Prozac was an extremely safe medicine that very difficult to overdose on, didn't have many drug interactions, and did a decent job. They're not as good as some of the old-time medications, but they're much better tolerated. Dealing with that stigmata is when you see your neighbor taking a medicine like that. Dealing with that stigmata is knowing that your next-door neighbor is also willing to talk to you about their depression and recognize those symptoms. I had a young lady in my office yesterday who is a teacher, and she's 29 years old and just cannot find joy in life. It's so elusive to her, and she doesn't understand why. She's got everything in the world going for her. And again, her depression is mainly grown out of anxiety, where she spends so much time in her future that she can't even stop and appreciate this moment. She's so blinded to what life is offering her at that very time that she just crashes. I want to help people understand that depression, that type of anxiety in our world is really mainly due to that overwhelming and abundance of choices that we have. Exercise is a great way to help manage depression. Kind of difficult for people to get the energy up to exercise when they're so emotionally exhausted. And what I like people to understand is the uniqueness to what your physical being is and how it was meant to be challenged in this world. A lot of people get depressed because they don't exercise and they don't challenge themselves to understand their soul. But again, that's because the emotional burden of life is so great for them. They're just completely exhausted. I said earlier that I used to believe that Americans just got fat and lazy. Well, I know they're not. They're tired, they're fatigued. And most of the time, the way that I interpret that is looking at their collective energy, where they invest their energy in life, and seeing that emotional burden. Trying to encourage them to exercise is always a good thing. Trying to fight through depression when that emotional energy is so exhausting is really difficult. Exercise releases endorphins that make you feel good. They help you deal with emotional burden in life. When you are physically active, how many people do you know that say they feel worse? That their energy level's worse, or they're sleeping worse, or that their appetite's terrible. So exercise does an awful lot to transfer energy away from the emotional burden into what physically we were meant to do. There's been hundreds of thousands of years that have made you and I the best of the best. Our ancestry got us to this point and we are not physically active. When we are physically active, we feel better, and I realized that we were meant to be physically active. I think I said earlier that just 150 years ago, 90% of Americans lived on farms, and we've taken that culture and completely changed it. Depression doesn't exist in the same way in other societies. Some pearls of wisdom to help people deal with or recognize depression, whether it be in a family member or a friend, are watch for someone who's become socially reclusive, that has changed their behavior and how they approach you in life. They feel, you'll notice this, they feel very unworthy of love, unwilling to give love, unwilling to accept love. They become socially isolated. One of those things is you've got to get them in, and I do believe that it's a collective role here, that if you get the appropriate support from family members, friends, possibly using some pharmaceutical intervention, getting a good therapist, someone who's willing to empathize with you and take you there. I also think that it's very important for someone who is depressed to be reminded of what it is they have, not what it is they have not. And most people who get depressed can't even see what it is that they have. They're so distracted by what they're potentially losing in the grieving process, for example, or what it is they never had, that they can't even see that what they have is everything they've always wanted. That's what ends up happening to everybody. I mean, everybody does that. Everybody stops. When you have that many distractions, as we do in our world, we completely stop appreciating what it is we have. I look at my life in this moment, and I realize I have the most unbelievable life. When I can stop in the moment and think about it, it gives me a shit-eating grin. When I am blinded a little bit by the what if of my future, or the anger or regrets from my past, I'm completely distracted from my ability to see, oh my goodness, I had never dreamed that I'd have what I have now in life. You have to take that person back to that element. You know, there are some other things about depression. In our culture, the majority of the depressive episodes that we see, like I said earlier, are related to the stress, or what I would consider mainly the emotional burden or anxiety that life has created for us. Is extremely treatable. You just have to confront it. It just needs to be confronted. That individual needs to see that there is opportunity to get better. And it clears. Time heals all wounds. People just don't recognize that in order to heal those wounds, you've got to tend to them.